When taking blood pressure, the patient should be seated in the chair for 5 minutes. They should not ingest caffeine or smoke a cigarette for at least 30 minutes before the measurement is taken. The measurement will be taken on the bare arm, and the proper cuff size should be used. The proper size will be determined by 80% of the cuff encircling the upper arm. The patient should be seated in a chair with back support, with both feet planted flat on the floor and their arms supported at heart level. The cuff should be placed on the bare arm, with the artery line being on the brachial artery. There should be an inch of space for where the stethoscope chest piece will be placed. The stethoscope needs to be cleaned with alcohol before being used. The prongs need to be facing the outward direction when being placed in the ears. Make sure the stethoscope is on by tapping the diaphragm. The diaphragm will be placed below the antecubital space over the artery, with 2 fingers pressed on the diaphragm in the form of a V sign. The cuff pressure needs to be inflated to 20 millimeters of mercury above the cord cough sound, but if it is the first time being taken, it is inflated to 200 millimeters of mercury. The pressure is slowly then released at the rate of 2 to 5 millimeters of mercury per second. The first cord cough sound heard when the pressure is released is a systolic blood pressure, the first phase. The second sound that is heard is a diastolic blood pressure, the fifth phase. At least 2 measurements should be made with a minute apart, and the average of the 2 should be taken. The blood pressure classification for normotensive systolic blood pressure is below 120 millimeters of mercury, and the diastolic blood pressure is below 80 millimeters of mercury. Prehypertension is the systolic pressure is between 120 to 139 millimeters of mercury, and the diastolic pressure is between 80 to 89 millimeters of mercury. There are 2 stages for hypertension. Stage 1, the systolic pressure is between 140 to 159 millimeters of mercury, and the diastolic blood pressure is between 90 to 99 millimeters of mercury. Stage 2 hypertension, the systolic pressure is above 160 millimeters of mercury, and the diastolic pressure is above 100 millimeters of mercury. The difference between stage 1 and stage 2 of hypertension is that with stage 2, more antihypertensive drugs are taken, and they have a higher blood pressure than stage 1. The patient should be provided with their specific blood pressure numbers and the goals both verbally and in writing.